So we actually started with the vaccination rollout back at the end of June. There were communities out there who jumped on board very, very quickly.
It's like a responsibility to myself as well as to the community, and I don't want to be the one to be putting someone else's life at risk.
There were other communities where there definitely was some hesitancy.
Are we just guinea pigs?
Work brought in the law that you have to get double vaxxed if you want to work there in any retail store, so I didn't really want to get it.
And so in the early days, some of the time was spent talking to people, answering their questions, educating them, and gradually bringing them on board so they could make the choice.
I sat on the fence for a while. I realistically just thought about it, kept putting it off, and then realised that I used to get the flu shots every year. What's the difference? So I decided just come and get it done.
We've gone into lots and lots of communities alongside the Aboriginal Health and Medical Services. We've worked with them to try and find the people that need to be vaccinated, and that's been quite an incredible partnership.
My mother, the age she's at, the community, my people, our town, everything just in general, you know, there to be safe.
We've been taking teams out of Dubbo and out of Broken Hill, going out to remote places. They spend the day or 3 days or a week in that community, and then they'll come back into base. They do the first round of vaccinations, and 3 weeks later they go back and they offer the second vaccinations. So we'd worked through a lot of that far west, and then we've come into more of the northwest of the state, and we're doing lots of clinics.
We're in the middle of what they call the Golden Triangle, and it's a massive cropping area, and it's ag, so everything around here is to do with agriculture and grain, cattle, everything, yeah.
We're part of an immunisation team. People have come out of retirement to join the team. Everyone has a sense that they want to help out.
And I retired just before COVID started.
I felt like I didn't need to be sitting at home on long service leave.
But I did feel really guilty that my colleagues were still there preparing for COVID.
People come in from out of town, you know, they drive in 60, 80 k's sometimes to be vaccinated.
We woke up around 8 o'clock, and that was our first plan today, to have our second dose done.
The pop-up clinics have made a huge difference to the availability of getting the jab here in Moree.
You know, a lot of us country blokes don't like doctors, so something like this is a bit easier.
So we get everyone to form a line in a COVID-safe fashion, and they come through. They get processed digitally, and we create a data for every person. They then come through and they see one of our immunisers. They get immunised. They wait for 15 minutes to make sure everything's fine, and then they go home.
In my workplace, we need to get double vaccinated in order to be rostered.
Just to be safe and keep my family safe as well. I'm also vulnerable.
So I can keep working, and besides, we've got a funeral next week. That's one of the reasons as well.
Day one in Moree, great response. We were busy all day. 324 locals were vaccinated. Probably up to 25% of the people coming are first dose. Well, we're headed to North Star and Bingra and Warrialders. So, yep, we've done that circuit before, so we're all doing second doses for those same clinics now.
It was convenient to be able to get my second jab here today, so I can, live my life like normal.
Well, I was going to get it because I'd rather have the vaccination and deal with the side effects of that than get the virus, and who knows what it does in 10 years.
And hopefully if we catch
Made
it,
it easy.
we don't die from it. You know? That'd be something handy.
We're really proud of what the RFDS is doing, and the opportunity to put the RFDS logo on our shirt is quite special, I think.
I do know here in southeastern though we're well over 15,000 now, which is huge, and we've done more since then. Nationally, at this point, the Royal Flying Doctors have done about 30,000, so that's all the sections put together, and we're still out there, and we will be out there until we've offered the vaccinations to everybody, first and second doses to everybody that needs it.